What is your diagnosis?
Multiple sclerosis.
Can you tell us more about it? When was it diagnosed?
What
were the first symptoms? How everything looked like?
Okay. In 2006, from my memory, I was fishing, and the sensitivity in my left hand I was unable to tie a fishing hook to nylon, and I asked a friend, could he do that for me? So I went on, we left the evening, and I then made an appointment in the hospital in England, and I went for nerve conductivity tests, which came up, there was some problems, and then I had a MRI scan, which showed up that on the back of my brain there was lesions, and the neurologist said that I was MS and he would like to see me for 15 months for further tests and bits and bobs. So this went on, and at the end of the 15 months he basically said to me that I was benign MS. I carried on working 2006, 7, 8, 9, 10. My wife unfortunately was diagnosed with brain cancer and has 8 weeks to live, and the shock of all of that was the first time for me. It really kicked my MS off proper, with symptoms and problems. So you carry on working up until the unfortunate death of my wife, and looking after my 2 children. I mean, Holly was 12 years old and Luke was 14. But slowly, little problems started to come forward. And then I started to ask myself questions. I really must find somewhere that I can get this sort of awesome help. My neurologist in the Royal Berkshire Hospital in England was absolutely a complete and utter waste of time. I found out about Swiss Medicare, which was fantastic, and just to receive help, help, was a step in the right direction for me. And I've been here now for 2 weeks, and every step of the way, every attention to detail by Swiss Medicare, I've been absolutely fantastic. So that's where I am today. But considering there was nothing offered, medication or nothing offered to me in England, if I was asked a question when I first got here, you know, and it's a normal presumption from anybody coming for therapy, treatment, you know, you want a list of things to be done. Actually, if I can just get my spark just a little bit lit, and I can go on with my daily life. I enjoy my living. I'm not in a wheelchair, and it doesn't bother me if that's the way. I've got to make some inroads to doing what I can for myself, because that's the only option. I've got a good sense of humour, and as long as I'm around to look after my daughter and son, I just think any little inroads in the 2 weeks that I've been here having the stem cell treatment, it is a massive step in the right direction. And you know, for anybody out there with any doubts at all, just ask, just look. Swedish Medicare are fantastic people, and That's it. Within 1 week I started with the gym, 5-6 days a week in the gym, on the walking machine, rowing machine, weights, cycling, rowing. The optical neuritis had ceased, and it just goes on from strength to strength. As they all noticed the difference in my speaking, cognitively, and I was able to listen and integrate with conversations with my family at home.